Hello and welcome to Rajya Sabha Television. You're watching COVID-19 India Fights Back. I'm Frank Rausan Pereira. Well, the centre has sought help from private sector, healthcare chains and industry bodies to vaccinate all 1.3 billion people in the country against the COVID-19 once vaccines are produced. The Economic Times reported that the National Expert Group on Vaccine Administration for COVID-19, headed by Niti Aayog member Health VK Paul, has sought views of industry bodies, including Federation of Indian Chambers of Commerce and Industry, that is FICCI, and Confederation of Indian Industry, or CII, and private hospital chains on functioning models or other funding models for vaccination. The meeting held earlier this month explored how the private sector could be involved in covering the population in the shortest possible time. While the government is planning to use its network to vaccinate priority groups, including frontline healthcare workers and senior citizens, it would not have the staff to cover other vulnerable groups like the economically weaker sections. The government has sought opinion on two issues: the funding model if private sector chains are used to vaccinate the poor in cities and in rural areas, and the investment required once vaccines are made available in the open market. In this edition of COVID-19 India Fights Back, we will analyze the participation of private sector in vaccination. Joining me on the program today are Dr. Alok Roy, Chairman, Health Services Committee, FICCI, and Chairman, Medica Group of Hospitals; Dr. Bishnoy Panigrahi, Group Head, Medical Strategy and Operations, Fortis Healthcare; and Dr. K. Madan Gopal, Senior Consultant, Health, Niti Aayog. Thank you to all my guests for joining me on this edition of COVID-19 India Fights Back. All right, Dr. Madan Gopal, let me start the program with you first. Clearly, the government is heading in a direction where it's getting ready to get some kind of a vaccination and then getting into a mode of trying to ensure that how we get this or work on the delivery aspect of the vaccination. So what's on the agenda really right now?
One of the things is that the government is committed to ensure that there is an equitable access to vaccine to all the citizens. We can look at the commitment which has been made from the Red Fort on 15th of August. Soon after that, there was a constitution of a National Expert Group on Vaccine Administration, which is overseeing all the vaccine aspects, right from distribution, who will receive the vaccine, who will be the priority groups, which vaccine would be procured, and how to involve that. The question here is that how to involve the private sector, because while the government is making its efforts to see that the priority groups are inoculated by July 31st of July 2021, but a lot of challenges are there. If you look at the example when the pulse polio immunization started, way back in 90s, in the mid of 90s, when this immunization started, we were grappling with the issue of having National Immunization Day, where the Rotary International, they were chipped in, and the other organization, they came into picture. As a result, that has become a successful. Now, we have been able to eliminate this polio from our country. Apart from that, that was only for children. Now, the challenge here is to inoculate the adult population as well, because first of the priority groups is the adult population. And across the world, inoculating the adult population is a big challenge. The private sector can play a very, very important role. One of the areas which they can do is the cold chain, because we don't know which kind of vaccine will require which kind of cold chain. If it requires a minus 20 degrees or minus 70 degrees, then there is a role for the private sector. And they have to map and quickly say that these are the cold chain facilities which are available to us, and the support can be extended to that. Apart from that, since one of the overlying principles of this COVID vaccination, proposed COVID vaccination, is that the routine vaccination services should not be hampered. So as a result, what happened that when the routine immunization is going on, we have to find out how this COVID vaccination will happen. For that, we require a lot of capacities in the form of vaccinators, and here also the private sector can at least give them capacity, saying that these are the number of vaccinators who are available with us, and
Sure.
can help the government in that. The
Right.
third thing is they have request saying that the corporates, the employees and their families, because if they don't fall into the priority groups which have been uh, told by the honorable this health minister and the member of the chairperson of the expert group, we have to find out if they come up with a pro, then we have to say that how they can procure the vaccine, from where they can channelize the fund for the employees and the employees' families. So that's an area where they can always look into that.
Absolutely.
Channelizing funds, the government is committed to provide all the vaccination. The central procurement is going to happen. And apart from that, there will be some sections of the population, as you have mentioned, they need to be covered, in which the private sector can be of immense help in that.
Okay.
Oh.
All right. So let me take the discussion forward. Now, Dr. Alok Roy, as far as the private sector is concerned, how can the private sector contribute as far as, vaccination, we go forward with this vaccine? Because let's not forget, it's a mammoth exercise, 1.3 billion people, something that has not happened before, something that has not been done before. We are going to take this on, on a war footing. So clearly, we need all hands on deck.
Mr. Pereira, thank you very much for inviting us. Let me one thing tell you very clearly, that private sector is as much required as the government is required. And we would do everything within our control to ensure the dissemination of vaccination. Every stakeholder of FICCI, every hospital, private hospital, which is with us or also not with us, but exists in this country, will come forward to ensure vaccination. We will train the host of doctors, nurses, A&M, paramedics, technicians, pharmacists, phlebotomists. We will create 1,000 of workforce which will inoculate people. They will do it in the hospital. They will step out, do it in the community. They will do it wherever the government requires us to play that role. As you see very clearly in this pandemic, the role which private hospital has played is enormous, especially in taking care of a critical ill patient. Most of the critically ill patients in the ICUs are parked in government private hospitals, and they have risen to the occasion. So let me reconfirm and reiterate. We will go to any extent to ensure that we inoculate the people in shortest time, and in the shortest time to the maximum number of people. Few points I'd like you to think of. That you need to provide us which is stable. We cannot go to the extreme of -70, -80 degree of storage. That may not fly because we don't have the kind of capability. But if it is -2 to 8 degree, so refrigerated, if the vaccine is stable, it can stay out for 12 hours in the non-refrigerated environment, in the room temperature. With the winter coming in, our applicability of vaccine is much, much higher. We have, each hospital can contribute 300, 400 inoculators, doctors, nurses, technicians, pharmacists, various people who are paramedical, who are available to us. Each person can do up to 80 to 160 inoculations a day. That kind of capability with each person exists. So if we provide you 1,000 people from one hospital to be available over a period of a week, you can multiply by 160. So we can do 2 lakh inoculations in a week's time. So that kind of support from just from one hospital is available. Each and every chain, whether it's a Fortis, whether it's a Apollo, whether it's a Narayana, any hospital chain in the country is willing to come forward and inoculate and help government in inoculating the masses. Remember, the private, the healthcare, 60 to 70% in the with the people who pay out of their pocket for the treatment. So when you are inoculating have-nots, also remember the rich also have rights. They also need to come up in a proper place where they need to be properly inoculated. So we should have both options existing, those who are not able to pay and those who can pay. Both should be taken care of.
Absolutely. All right. Since we are here then, Dr. Bishnu Panigrahi, this issue of channelizing of funds, getting the right kind of funds, because we have to carry out this mammoth exercise, that too is going to come up, quite often, and that too needs to be addressed at several levels. As far as private hospitals are concerned, What is it that the private hospitals are willing to do? How do we go about getting this behind us and getting this through?
So thank you, Mr. Pereira, for calling us for this. And as you rightly mentioned, there was a meeting with the person heading the COVID task force, Dr. Paul, and with our members of the FICCI. So whatever the private sector is going to do, it is going to be under the umbrella of FICCI, CIA, and we will work in tandem with the government. We will be partners to that. And on the funding part, to be honest, the modalities have not been decided on how it's going to be done. But in the back end, we are working out on how we can sort of complement the government to see that we can inoculate, whether it's the people who can pay out of pocket, the people who are insured, and also the have-nots, as Dr. Alok rightly mentioned, because we have to take out these boundaries between public sector and private sector healthcare, because health is common to everyone. So we are partners in this. How the modalities have still to be honest, has not been worked out. But in the back end, we have started an exercise on how do we sort of have our infrastructure in place, how do we have a manpower in place. And one thing which Dr. Alok rightly mentioned is training, because you have to train the people properly, and we have to set the expectations properly. In the sense, what I mean to say is that how many can you inoculate per day? So each healthcare that under the FICCI and CI umbrella, when we go about it, we need to streamline which are the geographies that we will be looking at, whether it is Apollo, whether it's a Fortis, whether it's a Max, whether it's Narayana, whether it's Medica, whether there are so many players. Plus another thing that we have to look at is that most of the private sectors are concentrated in the major metropolis. So we are looking at, from the FICCI point and CI point of view, how do we sort of get the nursing home associations which cater to the smaller towns and villages, which are there in the, I will call it Bharat. The metropolis is India, that is Bharat. So how do we enter Bharat? So that I think, so the major healthcare providers don't have the bandwidth. So we have to reach out to that. So as Dr. Alok rightly mentioned, we have to sort of work in unison to get about it. And I want to go back to your final, the main question that you asked on the funding modality. To be honest, that has not yet been discussed, or we have worked out that needs, there's a lot of discussion has to happen. And how do we, but we are clear on this, that we are there to partner with the government to see that we make this a success.
Absolutely. So taking the discussion forward now, Dr. Madan Gopal, there are several things that need to come together, so many aspects that need to, happen first, and only then can we see this go through successfully. For instance, there's the entire manpower issue that needs to be addressed, cold chains, storage, there's so much that needs to come together. How do we go about getting all of this done?
If you look at the scope of the work which has been given to the National Expert Group on Vaccine Administration, they are facilitating who will receive the vaccine, how the vaccine will be procured, and how it will be administered. More or less, there has been now consensus emerging about the priority groups, who will receive the vaccine first, for which whole of the preparation is going on. The ministry has the electronic vaccine intelligence network, and they are trying to advance that thing to use for COVID vaccine as well, with the guiding principle of not to compromise on the routine immunization. They have developed a beneficiary module in which the government as well as the private providers, they have been captured. They have been used. It's not that only the government will be doing, or all the government doctors, private doctors, the healthcare professionals who are there, who are the first priority list, they would be empaneled. And that beneficiary module is already being now rolled out and circulated among the different states. They are now using it. And apart from that, during the meeting which Dr. Roy and others are mentioning, saying that there has been a specific request made to these industry bodies. One thing is that if the vaccine, whichever vaccine candidates is approved and recommended by the National Technical Advisory Group, so we have to find out what kind of temperature the vaccine will require. If the vaccine requires the normal temperature 2 to 8 degrees, then that's not an issue, that the existing network can take care of that. But in case the vaccine requires -20, -70 degrees, then that's a challenge. here the role comes from here we have asked industry bodies to ask for the mapping of the cold chain so that whenever its need is there, then they can be roped in. So second challenge is apart without compromising on the routine immunization. Now the challenge is to have the COVID vaccination, which is an adult vaccination. It's not a similar kind of thing which we do in the universal immunization program. The inoculation is different. The inoculation is challenge and require vaccinators, where the private sector, they will come in with their capacities and the synchronization efforts can happen at that space. Right. The third thing is, can we utilize the other commitments of the corporates for their employees and the other groups which are not covered, but they are important for the corporates and the other persons. So that kind of thing we have to find out, okay, how we can bring them into the network of immunization. Till such time when the vaccine candidates have been identified, the procured and the administration, lot of things are going in parallel. So the government is well prepared to at least take care of the healthcare workers. Once it is upscaled to the general population, there comes the role of this private players and the private sector. As we have witnessed during the mass immunization when we were roped in this Rotary International kind of organization, they have supported they have made the pulse polio immunization, the polio eradication a successful thing. That kind of role is envisaged for the private sector now when the mass inoculation for the general public is open. Till such time when the healthcare workers, the frontline workers, I think the existing system is quite capable of handling these two areas. And once it comes to the general population, then we will definitely require the support of private sector, as we did with the Rotary International Exchange, which we have done with the polio immunization.
Absolutely, certainly. All right. So taking the discussion forward now, so we've spoken about some of the challenges. How do we address these challenges, Dr. Alok Roy? And we've also spoken about vaccine candidates. Of course, we have the Pfizer candidate, we have the Moderna BioNTech one, we have the Covaxin one, our homegrown vaccine candidate. So as far as, and there are a couple of others as well, and many more, of course, in the pipeline, but these 3 or 4 ones are in phase 3 trials, so we are hoping that we can get them soon. Everyone is looking forward to getting a successful vaccine. So as far as these vaccine candidates are concerned, are there any particular type of vaccines that could be far more suitable here in India than anywhere else? And also, you mentioned this in your opening remark as well about this issue of skilling. We are extremely skilled as far as vaccination for children are concerned. How do we translate that to adult vaccination?
See, adult vaccination is rather simpler. And there is a significant workforce in healthcare which is not involved in COVID fight. There are a certain set of people who are involved in COVID fight and huge population of healthcare workers which is not really into the COVID fight. They are available to us and they can be deployed immediately. The doctors, the DNB students, the pharmacists, the technicians, the phlebotomists, they're a huge force. And that will be available and that will be deployed. Now, what kind of vaccination, the choice of vaccination is not really in our hand. That's a national technical committee which is going to choose it. Our request to them would be to choose a vaccine which is stable at a higher temperature. Not if we have to go to minus 21 and minus 70, we are going to get into trouble. If it is stable at a higher temperature and can be stable at room temperature, we are happy to deploy, then we will have a better efficacy. If we have to ask which vaccination we'll prefer, the one which gives maximum immunization potential, which is more sensitive, which is more specific, which gives a higher antibody. And the knowledge about COVID is still evolving. Nobody is fully knowledgeable. There were no COVID experts till last year, December. We all have 8-10 months of knowledge. Next 1 year, 2 years will give us unfold more truth. So I think what is very important is to let you know that we are willing to support the government and we want to support it. Because it's much better to vaccinate the people rather than fight the battle in the ICU. It's much more painful, more expensive, and everybody is paying for it. Government is paying, insurance is paying, individual is paying, we are paying in losing lives. And also, please don't remember, not to forget, a lot of non-COVID patients are sitting at home who are not able to come to the hospital. They are dying of heart attack, they are dying of brain stroke, of knee pain, so many other things. So those people can come out. So it is an interest of the nation. Actually, there is no issue about private or government. Whether it's a government setup or a private setup, they belong to a state. The country owns both, and both will step forward to help the country in saving the country.
Absolutely. I think that's a great spirit to have. No doubt the healthcare workers, the healthcare fraternity has come together as one over the last 10 months or so and really shown us what they are capable of. A big kudos to all of you and your entire fraternity, and a big thanks as well for doing such a fantastic job and putting your lives on the line. Taking the discussion forward now, we've spoken about the challenges, Dr. Panigrahi. Let's talk about our strengths and what we need to focus on going forward.
See, the first strength, I think so, is first we have to decide on what is the vaccine that will come in, which will have the best logistic comfort for us. So I think so that is where Dr. Alok was rightly mentioning, because if you look at the Pfizer one, minus 70 degrees centigrade, it's a huge logistic nightmare. But the others which are there, whether it is the AstraZeneca, and is Oxford, and the indigenous ones which are being manufactured, which are being in the phase 2, phase 3 trials and already in India. So I think some of them have immense promise, and they can be managed with our infrastructure that exists. So that is the right way to go about it. So that is what I would like to say, is that that is the first challenge that is there. Second is that we need to be clear on the priorities. What are the because as I said, government and private, it's the same. But we need to have a plan that which are the areas that the government can go, and they will do it with the district health center, the primary health centers down below. And because, as I said earlier, asked the private health sector, the strengths that lie more in the metropolis. So this planning has to happen first. That's the first part of it, because because unless you plan it properly, the processes are put in place, your outcomes may not be appropriate if we don't plan for it. So that's the first most important thing, is putting the cart before the horse. So let's be very clear on which are the areas that we have to map out. Then, as I said earlier, under the FICCI and CI umbrella, we are planning to see that these are the geographies that the private health sector is looking at. And in parallel, we are trying to see that we train our staff properly, and we know who are the people who will be deployed there, and accordingly put our infrastructure in place, our logistics in place.
Absolutely. All right. On that note then, I'll call it a wrap on this edition of COVID-19 India Fights Back. What our panelists are suggesting is that we need to have a foolproof plan going forward if we have to ensure that we carry out a successful vaccination drive. We need to choose the right kind of vaccine candidate as well. And the private sector and the government are one. We need to just focus on each other's strengths and go forward in that particular way. Thank you to all my guests for joining me on this edition of this program and putting things into perspective for us. Before we leave, Rajya Sabha TV would like to make an appeal to all its viewers to stay safe from the coronavirus pandemic. Remember to wear a face mask and also ensure that you wash your hands and face regularly, and ensure that you also maintain physical distancing wherever you step outside. These small steps can go a long way in fighting the virus. As of now, this is the best protection that we have from the virus, and not a vaccine, because we still don't have one yet. With that, it's a wrap. See you again next time.